Brain, Spine, and Scoliosis Clinic of Davao Doctors Hospital is the first in Mindanao offering specialized care under one roof. This facility brings together a team of highly qualified specialists including neurosurgeons, neuro and spine surgeons, and scoliosis surgeons. In this episode, we are joined by our experts, Dr. Ronald Tangente and Dr. Rommel L, Orthopedic, Spine, and Scoliosis Surgeons, and Neurosurgeon Dr. James Mercado to talk about the Brain, Spine, and Scoliosis Clinic.
The most common cases that we see in the center is one is degenerative conditions that will affect the cervical spine. These are commonly seen in elderly patients. And then we try to correlate the symptoms. I-pair namin yung symptoms niya with what we see on the MRI. And then in most cases, these patients are treated conservatively. Either they will be referred to physical therapy, and then only a few of them will eventually need our services, surgery. The second thing that we commonly see is spinal deformity, mainly scoliosis. We have a very good number of patients all over Mindanao with scoliosis, and then the good thing is we see them early and then we put them on a brace, and very few cases that will eventually need surgery. I have been in private practice in Davao City for siguro mga 25 years, and I've realized that I cannot do it all. And so we've invited very good surgeons coming in, well-trained spine surgeons and neurosurgeons to build up the spine center in Davao Doctors Hospital. So the greatest advantage in our center is that we have very good surgeons that actually work well together, and that with the intention of giving the best care as far as brain surgery and even spine surgery to the community. So Davao City residents are now being catered very well, and most of them do not go to Manila or even Cebu for their treatment.
There are common cases that are being referred to us here in our clinic in the Brain and Spine and Scoliosis Clinic. In neurosurgery, sa mga adult namin na mga pasyente, common cases being referred to us, aside from brain trauma, are brain tumors. So these are patients na who will present with increased pressure sa utak. So they will come to us with sakit ng ulo, nagsusuka, or nangihina or namamanhid ng any parte ng katawan. We usually order cranial CT scan or MRI for these patients. So ano ba ang usually ginagawa namin for these patients? So we basically remove the tumor, and that's an open surgery. And some of our patients thereafter will be referred to radiation or chemotherapy if they need it. For our pediatric patients naman, common cases being referred to us ay yung tinatawag natin na hydrocephalus. So itong mga bata na to will present with increased pressure pa rin sa utak. So they will present with sakit ng ulo, nagsusuka, poor activity, or irritable. And in the long run, lumalaki yung ulo nila. So how can we diagnose these kind of patients? So we can do cranial ultrasound or a cranial CT scan. So we manage this surgically, yung tinatawag namin na shunting, para ma-address yung hydrocephalus ng mga pasyente na to.
For scoliosis, the definition niya sa SRS is it's a deformity of the spine, no? Coronal. When you say coronal, nakaganyan. This is the sagittal, pag ganun. This is the coronal. Now, what happens is that usually this develops during childhood, no? So there is an early onset. Ang early onset is less than 10-year-old. Adolescent idiopathic scoliosis is mga 11 and above. And then you also have adult onset na scoliosis, no? Now, the focus on the pediatrics is mostly prevention ng pag-progress ng curve. That is why early on, we put them on a brace, no? Para naman hindi lumala yung kanilang scoliosis. So, no? Now, when it comes to adult onset naman, The most common is yung sa degenerative scoliosis, no? Yung sa degenerative scoliosis, ito yung mga elderly patients natin who has deformity ng likod. Usually, this happens because of the degeneration of the disc, yung pag wear and tear ng disc natin. The next one is osteoporosis, nagkakaroon ng pathologic fracture sa level na affected. So, ang tendency is nagkakaroon ng pagtabingi ng spine. What will happen to them? They will have coronal imbalance or mawawala yung balanse sa katawan, medyo mahirap maglakad. Mahirap tumayo ng straight. And occasionally, they will have back pain and leg pain. What do we do? If we can put them on a brace, better. But if the scoliosis gets also severe, we can also do surgery. We can do fusion surgery to prevent it from progression. If you are experiencing any problem related to your brain or your spine, please consult Brain, Spine, and Scoliosis Clinic. Early detection or diagnosis and treatment is very crucial. Thank you very much and have a nice day.